Peace be upon you. In the name of God, most gracious, most merciful, Your Excellencies, welcome to this press conference which is held on the sideline of the visit of Dr. Ahmed Mandhari, WHO Regional Director of the Eastern Mediterranean, which comes after a year of the opening of the regional country office in the Kingdom of Bahrain to be informed on the recent updates and the achievements of the Kingdom of Bahrain in combating COVID-19 by the WHO. Now, ladies and gentlemen, the continued coordination and collaboration between the Kingdom of Bahrain and the WHO, which goes for a long time, emphasizes the commitment of the Kingdom of Bahrain to develop the services in all health services in order to achieve the mutual desired goals. Now, we have a video of the speech of Dr. Tedros Ghebreyesus.
Excellencies, dear colleagues and friends, Assalamu alaikum wa rahmatullahi wa barakatuh. I'm pleased to present this new case study from Bahrain's experience managing the COVID-19 pandemic. It shows that preparedness, leadership, and multi-sectoral collaboration are critical for a well-managed response to health emergencies. Under the lead and guidance of His Royal Highness, the Crown Prince and Prime Minister, a national task force for combating COVID-19 was promptly mobilized after the discovery of the novel virus. When the first case of COVID-19 infection in Bahrain was confirmed in the early morning of the 24th of February 2020, the government moved quickly. All citizens and residents in Bahrain were given access to free testing and treatment. Prevention, preparedness, and response activities were implemented swiftly in a whole of government, whole of society approach with support from WHO. Bahrain contained the spread of the disease thanks to early testing, high vaccination coverage, and the continued provision of essential health services with a well-trained workforce. At the same time, Bahrain managed a number of challenges during its response, including repurposing the workforce, acquiring sufficient protective equipment, and outreach to vulnerable populations. As cases have been on the rise lately, continued vigilance is needed. My thanks to the government of Bahrain for sharing their experiences. We hope that the lessons from Bahrain's experience will be useful for other countries in the Eastern Mediterranean region. I thank you. Shukran jazilan.
Thank you, Dr. Tedros Adhanom, Director General of the WHO. Ladies and gentlemen, the Kingdom of Bahrain is committed through the modern and developed strategies to achieve the goals of the WHO in order to combat COVID-19 and to support all the international efforts to combat all the diseases and epidemics. And now would like to invite Her Excellency Dr. Jalila bin Said Jawad, Minister of Health, and Dr. Ahmed Al-Mandhari, WHO Regional Director for Eastern Mediterranean, to be on the floor. Ladies and gentlemen, now we'd like to invite Her Excellency Dr. Jalila bin Said Jawad, Minister of Health, to deliver her speech. In the name of God, most gracious, most merciful, peace be upon you all. At the beginning, we would like to welcome Dr. Ahmed Al-Mandhari, WHO Regional Director for Eastern Mediterranean, in his second home, the Kingdom of Bahrain. And we welcome you, ladies and gentlemen, and we thank Dr. Tedros for delivering his video speech. And we reaffirm that the Kingdom of Bahrain and implementation of the royal directives of His Majesty King Hamad bin Isa Al Khalifa King of the Kingdom of Bahrain, may God protect him, and the follow-up and directives of His Royal Highness Prince Salman bin Hamad Al Khalifa, the Crown Prince and Prime Minister, the Kingdom of Bahrain is continuously going to with the collaboration with the WHO in order to achieve the desired goals. And this collaboration was resulted in the opening of the country office in the Kingdom of Bahrain that reflects the fruitful relationship and the continued coordination between the Kingdom of Bahrain and the WHO. And this relationship is deeply rooted in history, and it's not new. And the Kingdom of Bahrain appreciates the continued support of the WHO, especially from the regional Eastern Mediterranean, in order to achieve health for everyone. And as examples is the declaration of the WHO in the middle of 2021 as the capital of health for the good health services, in addition to the initiatives to spread awareness among community and the developed programs that achieves the combating the chronic diseases. The Kingdom of Bahrain will continue the efforts of the WHO in order to combat COVID-19 and to support all the efforts internationally in order to combat diseases and epidemics. And we would like to confirm that the Kingdom of Bahrain, through its national efforts to combat COVID-19, under the leadership of His Royal Highness Prince Salman bin Hamad Al Khalifa, the Crown Prince and Prime Minister, may God protect him, and in line with the precautionary steps to combat this challenge, we've set a long path to combat this pandemic locally, and we've shared with the regional and international countries the experience. And we have to note the role of the National Medical Task Force for combating coronavirus, headed by His Excellency Lieutenant General Dr. Sheikh Mohammed bin Abdullah Al Khalifa, in this regard, with the coordination with all the sectors in the country who played the one spirit role in order to change these challenges into opportunities. And thank to God, the Kingdom of Bahrain, along with this campaign for providing vaccination for all citizens and residents free of charge. And I confirm that the Kingdom of Bahrain will continue to implement all the developed strategies to develop all the strategic and technical support in the health field in order to ensure the provision of sustainable health services locally and in a sustainable manner. The health sector in the Kingdom of Bahrain gets the attention, the full attention of His Majesty King of the Kingdom of Bahrain, may God protect him, and with the follow-up of His Royal Highness the Crown Prince, may God protect him, to provide the necessary support in order to achieve the development and the safety and health for everyone in the Kingdom of Bahrain. And the health services are flexible, and they are coping with all the changes, and therefore quickly coping and responding to all the challenges. And this was reflected in the COVID-19 pandemic, and we were proud to be documented as one of the first countries to be documented by the WHO in a case study report that will be shared with all the countries internationally. The Kingdom of Bahrain believes in protecting every individual in society and internationally as well. and the efforts of the Kingdom of Bahrain to combat COVID-19, as witnessed by the WHO, shows the commitment of the Kingdom of Bahrain to share its experience and to let other countries benefit from this experience. The success story of the Kingdom of Bahrain is the fruit of the wise leadership and vision and the ongoing efforts of the government, as it is based on specific strategies and action plans in line with the international plans. First, there was a clear and timely plan developed to respond to COVID-19 based on evidence and backed by laws and regulations, and providing efficient systems to monitor, track, and treat, and providing the necessary vaccines free of charges for citizens and residents, and enhancing the home quarantine and protecting citizens and residents if they are in contact with existing cases or suspected cases by identifying the GPS features and having braces, and also providing the vaccines which have proved to be efficient and they are free of charge for citizens and residents alike in order to cover all the population and also to provide all the services for them. Also adapting the technology and transfer to digitalization and promoting medical research, and also implementing the applications and the fourth generation in order to combat COVID-19 by implementing all the highest safety of technology while coordinating with the government and non-governmental sectors, and to spread awareness in a very transparent manner with society and raising awareness among them, while investing in human capitals and trying to encourage innovation in order to include many other services. So all of these as brief, this is really quick, brief, to show the mechanism of the Kingdom of Bahrain, and we cannot neglect the role of the media as a basic partner to spread the right information in order to enhance the services and spread awareness among society. And as you, Dr. Al-Mandhari, have witnessed the great development of the Kingdom of Bahrain in combating COVID-19, you were here at the beginning of the pandemic, and you are now here to witness the experience and document it by the Office of the Eastern Mediterranean, as well as your country office, and how we coped and managed to combat this. And you have had a visit and you were been informed of the plans that are in line with the WHO. And in this line, I confirm that the Kingdom of Bahrain's achievement of the SDGs in line with the spread of the pandemic is a great proof that the essential health services and national health programs and strategies were not affected by the pandemic, because the Bahraini society's health is a priority on the government action agenda, and that the Kingdom of Bahrain will continue to develop its health system and will always enhance its services for treatment and preventive services, and that the coordination and cooperation between the Ministry of Health as well the health-related sectors with the WHO in its country office in Bahrain, and with the continued meetings with Dr. Ahmed Al-Mandhari and Dr. Tedros, the General Director of the WHO. And to conclude, we are proud of the achievements of the Kingdom of Bahrain, our beloved country, in combating and confronting COVID-19. And we will be within the same spirit, Team Bahrain spirit, and we thank all the workforce and the BDF and all the society, and we cannot neglect the role of the volunteers. We really appreciate the efforts of everyone in protecting the health and safety of citizens and residents. Health is the core of our development in the Kingdom of Bahrain. Thank you very much for listening. Now the floor is to Dr. Ahmed. Thank you very much, Dr. Jalila bin Sayyid Jawad Hassan, Minister of Health. Ladies and gentlemen, the joint collaboration between the Kingdom of Bahrain and the WHO has resulted in opening the country office in the Kingdom of Bahrain that has reflected the deeply rooted collaboration between the Kingdom of Bahrain and the WHO. And now we invite the Dr. Ahmed Al-Mandhari to deliver his speech. Thank you very much. In the name of God, most gracious, most merciful, peace be upon you. Good afternoon, everyone. Her Excellency Dr. Jalila bin Sayyid Jawad Hassan, at the beginning, I'd like to congratulate you on assuming the Ministry of Health, and I wish you all the best. And I trust that you're going to continue the path of success that have already achieved for many years, and we are all proud of, not only regionally, not only in GCC, but internationally as well. And I personally trust that the team and the Minister of Health, as well as the other teams in different public and private sectors, are going to do whatever they are assigned to do the success. So I wish you all the best. Ladies and gentlemen, peace be upon you. Well, I am honored to visit my second home, the Kingdom of Bahrain, and I feel really welcomed home, and I'm really honored to be among you today while celebrating the case study report on COVID-19 in Bahrain. Well, the Kingdom of Bahrain was among the top countries that I visited in the region in March 2020, shortly after the first announcement of the first case. And during that visit, I was honored to visit the leaders in the Kingdom of Bahrain, and I met with the different workforce in different sectors. During that visit, thank God, and while really feeling proud, I've seen how the Kingdom of Bahrain worked, as Bahrain has signed different conventions for 2005, and how Bahrain has been committed in advancing and developing their workflows and identifying the diseases and responding to them. And Bahrain has always been committed, even before the pandemic, to work on ensuring health and prosperity for its citizens. And at the same time, as Bahrain has extensive experience for influenza, N1, H1, and SARS, as they are both threats of pandemics, the quick spread of COVID-19 required a different methodology to respond to it that was out of the blue. And now, after 2 years since the declaration of the first case in the Kingdom of Bahrain, I'd like to announce a number of the achievements that would highlight the health system and how it responded to COVID-19. And while the case study that we are proud to launch today focuses on the results of the delegation sent by the WHO in 2020, and it covered the different levels, I'd like to pause shortly to express my feelings on that visit for a number of the facilities that have great role in the Kingdom of Bahrain's role in responding to COVID-19, as Salmani Medical Complex and Khalid bin Abdullah's hospital. And I've seen investments and real investments that are employed and those facilities in order to respond to COVID-19. And I met with doctors and nurses, volunteers, male and female, and different professionals that are up to now have the positive spirit and show commitment despite the difficult times they experienced during that pandemic. And I was amazed how much they were proud in serving their country and saving the lives of their brothers and sisters regardless of their nationalities. And they are the real heroes in combating COVID-19. And in the surgeries room for the Crown Prince Center for Studies, I've seen how to respond as a center for all information to be collected in order to issue decisions, and it contained a number of rooms on high level at the government, and this is in response to the recommendation of the WHO, which covered the whole government. And the Kingdom of Bahrain has implemented a comprehensive strategy for the whole government and sectors to respond to COVID-19. As a response to this, integrated and completed, I recognize that the Kingdom of Bahrain is among the leading countries to respond to COVID-19. It has implemented a comprehensive procedures to prevent the spread of the virus from the beginning, even before the identification of the first case, and under the wise leadership of the King of the Kingdom of Bahrain and the right follow-up of the Crown Prince. We wish to congratulate the Kingdom of Bahrain of all that it followed to respond to the COVID-19, which was comprehensive and included the whole government. This methodology proved that this was the right path to contain the disease and save lives. And I also would like to praise the health system of the Kingdom of Bahrain in providing all the essential health services in a very high level to all people in the Kingdom of Bahrain, regardless of their race or nationality, in order to ensure the provision of those health services. Ladies and gentlemen, Your Excellency, and on this day, I reiterate my sincere thanks to you and to your team and to all the teams and the sectors that contributed the visits. So I would like to reiterate my thanks. In June 2021, the Kingdom of Bahrain and the WHO went to move forward to enhance their relationship by opening the country office in Manama, which is the 20th country office in the region and the 152nd office around the world. And this is among the efforts to provide and save lives. And the country office facilitated providing templates and integrated the action programs of the United Nations in order to develop the health services and programs in countries. And having this country office in the Kingdom of Bahrain is a great example for the best practices and to document the experience of the Kingdom of Bahrain and to benefit from their lessons. And that's why we're here today, not just to recognize the exceptional rules and efforts of the Kingdom of Bahrain, and also to ensure that other countries might benefit from such documentation of this successful experience. And this report reminds us of something valuable, that together we can fight and combat those epidemics, and we can build strongly. And we cannot combat this pandemic that is still killing people without sharing resources and experiences and implementing our vision for 2030 for the health for everyone. Thank you very much, Doctor, for this opportunity, and I'm really proud to be with you. Thank you very much for the welcoming me. Thank you very much, Dr. Ahmed Al-Mandhari, WH Regional Director for Eastern Mediterranean. Now we'll leave the floor for the questions for the journalists and reporters. Just to remind you, please mention your name and title. Mohammed Rashad from Al Watan newspaper. I just would like to say something. As citizens and residents in the Kingdom of Bahrain, we're really proud of what the Kingdom of Bahrain has provided, and the National Medical Task Force have provided, and to the point that the Kingdom of Bahrain has turned into providing health service for everyone. Now, there are a number of challenges for all the countries around the world in enhancing the trust and confidence of citizens on vaccination. And some people around the world reject to take the vaccine. What do you think, and how do you assess the Kingdom of Bahrain's experience in terms of vaccination? Thank you very much for the question. Well, as known, there are somehow, even before the pandemic of COVID-19, some people would tend to reject vaccination. By a small percentage of people if we compare it to the global population. But unfortunately, such small percentage is still active even before and after the pandemic, and even during the distribution of the vaccines. And it has done great efforts in order to spread misinformation through different channels. Well, vaccination, thank God, has saved many lives throughout history. And we had for many years children that they died their first years because of the infectious diseases. Some kids would have the paralysis. Some women would die because of the German fever. But with these vaccines, thank God, the countries were able to reduce those death rates from hundreds of thousands to 10,000s, from 100 to even 0 cases. Thank God, and thank to those vaccines. As I said, COVID-19 was a chance for the countries to push more resources and research, so the period was shorted to from tens of years to a year, and the WHO was working closely with those companies producing the vaccines in order to ensure the safety and efficiency and efficacy of those vaccines. And the WHO wouldn't approve any vaccine without being safe to human beings. And if we compare what those groups or anti-vaccine people say about those who took the vaccines, it is just a very small percentage. So we have to take our role as media, as health workforce, to combat such misinformation pandemic. Thank God the Kingdom of Bahrain's experience is really enriching, and it is among the top countries that started to provide the vaccines to citizens and residents without exception, as you mentioned, and it is recognized in different meetings regionally and internationally. Thank you very much. Good afternoon, Mohammed Rashadat from Bahrain TV. Well, at the beginning, I'd like to welcome Dr. Jalila, while assuming the Ministry of Health. Well, Your Excellency, based on what has been achieved of success, previous successes, how can we maintain this success and over the coming period of time? And also a question to Dr. Ahmed. Welcome to Bahrain. Dr. Ahmed, you mentioned about the benefits of vaccines for many decades, but recently we would like to hear a new vaccine. And as mentioned by my colleague Mohammed, a new vaccine. Every time there is a new vaccine. So how do you ensure the efficacy of these vaccines? Those companies who are producing the vaccines, how do you recognize them internationally in order to distribute them to the other countries, and also to increase the confidence and trust of those people taking the vaccines towards these vaccines provided internationally? Thank you very much for the intervention and for the congratulation. Well, the health system in the Kingdom of Bahrain has shown to be solid and flexible at the same time. To cope with the changes, the urgent health changes, was based on something solid for many years. So it is not just at the moment, while there are systems that were collapsing or were greatly affected by the pandemic. We've seen the health system in the Kingdom of Bahrain to be solid, at the same time to cope immediately and to achieve great success stories to be documented by the WHO. So we are building on these successes by implementing these strategies, programs, the international ones, the regional ones, and the local ones, in accordance with 2030 vision. And we're moving forward to implementing the health insurance system, and we are continuing to implement that for the sake of the citizens and those beneficiaries of this, because the health of the citizen is the essential and core thing that we focus on in the Kingdom of Bahrain. Also, there are a number of new projects and initiatives like the Genome Project, which achieved many things in different countries. And also in the Kingdom of Bahrain, we might share it with the regional countries, as mentioned by Dr. Ahmed. It will help in developing the future plans and the early identification of diseases. It is really important to enhance treatment, to early identify diseases, to manage the health issues with the collaboration with all the beneficiaries in order to improve the quality of life. Thank you very much for the question. To answer to your question, the companies producing the vaccines, they go through different stages and experiments. Well, there have to be lab experiments and then experiments on animals with specified numbers, and then we move to clinical trials on humans, for example, with tens of people, then hundreds of people, then thousands of people. After that, the organization will receive the documents on those vaccines with all the different chemical components, and there is a specialized team that would review the documents, and then if there are any inquiries, they'll be sent to those countries or the country or the companies producing the vaccines. There will be field visits to those companies, and during those visits, we will meet with all the people in charge, the lines of production, including the analysis of those components of the vaccines by different companies which are specialized in this field, and then the WHO will either approve or disapprove or postpone the approval until they answer certain inquiries or change or certain requirements. This is the role of the WHO in approving the vaccines. At the same time, the WHO, through COVAX, like we're talking about COVID-19, to coordinate with the countries and the companies, producing the vaccines to spread the vaccines to all the countries regardless of their resources, and equally that would ensure the distribution to everyone. But you've witnessed at the beginning of the distribution, we've witnessed a great challenge, which is the high shortage of the vaccines and the difficulty in transferring those vaccines to certain countries. Their technical capacities, for example, in terms of storage, supply, the distribution of those vaccines to their country, to their cities. But thank God, we have developed the capacities for them, and we managed. Good evening, Rachel Ibrahim, Bana. Question to the Minister of Health. This report is exceptional nationally and reflects the great efforts exerted by the Kingdom of Bahrain in combating and confronting COVID-19. My question, what does it mean that the WHO has done in establishing and launching this report, and will this lead to many reports in the future? Thank you very much. We are proud to document the experience of the Kingdom of Bahrain by the WHO. The documentation by the WHO and sharing them with different countries reflect the leading role played by the Kingdom of Bahrain and how to respond to such pandemics. So we are proud and will held us more responsibilities and more achievements, and hopefully we're moving forward with the wise leadership and the strong political determination and the use of resources and the other elements mentioned at the beginning, including the provision of human workforce, the use of technology, and other ones that we mentioned. But I confirm that this responsibility, the Kingdom of Bahrain can handle it, and it will be followed by many experiences to be shared with the region and the world. Not only reports of cases, but also research, the development of research that would enrich the globe and the humans as well, to have investment in education is one of the lessons that we benefit from this pandemic. Raji.
I'm Raji from the Gulf Daily News. Congratulations, Dr. Jalila. It's a real pleasure to see you as a minister. And Dr. Mandhari, you're no new because your regular press briefings online has always kept us abreast. Thank you very much. Thank you. On that note, it's very much a moment of pride to witness the great achievements of Bahrain. We were just reflecting as to how we sat here 2 years ago when we reported the first case, and today it's so much of fresh whiz of air. On that note, I have a question to Dr. Mandhari and to Dr. Jalila. Dr. Mandhari, with countries lifting all restrictions, especially travel-related, while we have the health regulators like the CDC warning on travel delays and urging individuals to check twice before they travel, even if they are fully vaccinated, how would you reflect on this from the regional perspective, especially when we have, unfortunately, cases on the rise, mostly asymptomatic, plus with the Eid celebrations and festivities and vacations forcing many people to travel? How do you reflect on this? Would you recommend travel restrictions or consider restrictions of the kind, not to the full extent though? And Dr. Jalila, following the questions on the vaccines from my colleagues, we have been receiving messages on the fourth booster dose, the second booster dose or the fourth dose of the vaccine. It has been recommended. How do you foresee, people are just taking it light, and also the periodic booster doses, which is recommended every 6 months or 6 to 9 months. Do you foresee the kingdom making it mandatory, like the first booster dose? How would you foresee this possibility as we move closer to curbing the pandemic optimistic about it. At the same time, unfortunately, we are seeing rise in number of cases. Thank you very much.
Thank you very much for this important question. In fact, I may just give brief answer of that. Statistics, coming to WHO from all countries around the globe have shown us that there is an increase in the number of the COVID cases at a global level. At a regional level, there is an average increase, but in certain countries, not all countries. However, the good thing, of this increase compared to the earlier increases last year and the end of this year, beginning of this year, but mainly last year, it is not really linked with an increase in the number of admissions. Number one. Number two, it is not related or linked with an increase in the number of the deaths that are reported due to COVID-19. Most of the cases infected with COVID, most of them are either with mild symptoms or with no symptoms at all. They just discover themselves that when they do the testing, the rapid antigen test, they are positive. The other good thing in this, sort of detection, the behavior of the people have changed. Many people, when they find themselves positive, they isolate themselves, at least they put themselves in isolation for some time. They inform others that, sorry, I'm infected, I'm positive, although they don't have maybe sometimes symptoms. So the behavior of the people have changed compared to the beginning of this pandemic. They wear the masks, Yes, it is still a challenge, many people are trying to avoid it, but they wear the mask. We see people wearing the mask all the time. WHO has published, in fact, last week or this week, like a guideline to all countries when it comes into how to deal with the mass gatherings during Eid holidays and during Eid season, including Hajj. And in that sort of guideline, WHO is recommending that countries should continue the basics of surveillance, tracing and detection and testing of people to avoid any sort of gaps in identifying the positive and contacts. And countries are recommended to share information and report it to WHO so that we have a global, regional and global picture. Countries are again recommended to move as the whole of government and the whole of society concept. Health systems are recommended to give full protection to healthcare providers, same way that have been given in the past to avoid any sort. So, generally speaking, the countries are recommended to maintain the same level of preparedness for any emergencies, God forbid. When it comes into communities, they are also recommended to maintain the same public, and social health measures that have been implemented in the past, with no change, in order to avoid any sort of abrupt increase in the number of the cases. But when it comes into restrictions, it is not that much needed compared to the earlier days and weeks of the COVID-19, because as we all know, restriction of movement it has its own limitations, and I think now it is not the right time to make that sort of decisions compared to the beginning of this pandemic. But we I think should really be careful and continue adhering to these public health and social measures that have been implemented in the past. Thank you.
Thank you, Dr. Mandhari. Regarding the vaccination, first I want to reframe what you have mentioned, and it is very important that it is a shared responsibility. With time, since we began the pandemic until today, a lot of information has been gained by the public, and it has been proven that our community in the kingdom, they are really aware and they are really taking their responsibility. This is why, because of this, we are here today, without masks, sitting together. In fact, the basic infection control, like hand washing, going to the health facility with the mask, is still continuing in the kingdom. And wearing the mask is always continued an option. For vaccination, with COVID-19, it was never mandatory in the kingdom. It is always by choice regarding the time and even taking the booster or not. However, The people has the right to know and to ensure that the information is available. And this is what we are doing through the different media channel. So the number of cases, the incidents, the hospitalization, the death is always available. The information about different type of vaccines and their reported side effects up to date and the reported benefits and immunogenicity post-rollout is always available. Even the accessibility is there. So booster doses are available. And the risk of disease, it is always weighing risk to benefit, and we encourage especially those who are vulnerable and those who are eligible for booster doses to take it to protect themselves. Viruses could infect anyone at any time, and building immunity is very important. It is not only about you. It is your responsibility toward yourself, toward your family, toward the beloved people, toward your community and country. So thank you.
In the name of God, most merciful, Yasser Hilal, Al Bilad newspaper. Thank you, Dr. Jalila, and congratulations. You mentioned in your report the efforts of the Kingdom of Bahrain to combat COVID-19, and it has a great question. To what extent the Kingdom of Bahrain is prepared in light of the challenges around the world? To what extent the Kingdom of Bahrain is ready? And the second question to Dr. Ahmed, the regional director. The Kingdom of Bahrain has, since the declaration of the first case, has provided experiences and research to combat COVID-19, and these efforts through your media. My question, in your opinion, what is the role played by the Kingdom of Bahrain to combat COVID-19, especially the collaboration between the Kingdom of Bahrain and the international context? Thank you very much. As we mentioned before, we're building on the solid health system that proved to be efficient through proactive steps and vision. We collaborate with all sectors, and it has a great role. And what the Kingdom of Bahrain has witnessed of empowering the workforce and the use of technology have great impact on the results that we have achieved, and to respond immediately while developing the plans and implement them. Well, there are capacities that we build either to identify the diseases, the nursing and doctor cadres, also the labs have had great impact on identifying the diseases and to collaborate in line with the international guidelines and indicators issued by the World Health Organization. This shows that the country is prepared. There are also some mock trainings that are done and conducted, and Bahrain has done already in collaboration with the WHO, and they are ongoing to see that the Kingdom of Bahrain is always ready should there be any disease or pandemic, in addition to having other committees like the disaster committee in order to ensure the health and safety of all the society of the Kingdom of Bahrain. Thank you very much for the question. Well, truly the Kingdom of Bahrain experience in dealing with COVID-19, we can say that it has exceeded the kingdom's level and borders as a personal and regional experience. And also the headquarters in Geneva. Bahrain is among the top countries that would share their information about the infections, about the active cases, the death rates, and the services, the challenges they faced. So it is among the top countries. The second thing is that the participation and sharing of the experiences, we've had delegation from the Ministry of Health regionally and internationally to share their experience. And thank God it was fruitful. Many countries benefited from this experience, and they are now working within the same line. So since the pandemic, the beginning of the pandemic, up to now, the third thing that the kingdom research and studies to combat COVID-19 in terms of identification of the disease, protection, and prevention. And they were published in magazines and different around the region and international levels. And they were being used by experts in order to spread the knowledge to the world. So these are just 3 examples that I can give you to show you that Bahrain has provided and shared their success stories, not just within the borders, but outside the borders of the Kingdom of Bahrain. To conclude, we would like to thank... Hello? Good afternoon. Hassan Abdul Rasul from Al Bilad newspaper. I'd like to ask the Minister of Health. 2 years ago, the Minister of Health has launched Genome Project, and a number of blood samples were taken by those who approved to be volunteers. When is it expected to declare the results of the project? This is question number 1. Number 2, now with as we're witnessing people are going to travel abroad, would you recommend those people to take the seasonal flu vaccines to enhance their immunity system? And our dear guest, Dr. Ahmed, have the flu seasonal vaccines shown their efficiency in line with COVID-19 vaccines? Thank you very much. I thank you for the follow-up of the projects in the Kingdom of Bahrain that always achieves the health and safety in the Kingdom of Bahrain. Well, Genome Project has a big role. It creates a map, a vision, a genetic map to identify those rare diseases and to consider the solutions and development of treatment plans. We've collected a number of samples, more than 30,000 samples. We've shared some of them with Harvard University, and we've conducted a number of testings, and we're still coordinating with the authorities concerned to check the results, and then we will share them with those who volunteered. Some of them, they realized that the results might not be available at the same time because they'll be studied and it will take some time. This is the first part of the Genome Project, and we are proud of having many people from our society participating in this project, and we hope that many people will do so in order to achieve the desired goals that would go for the sake and benefit of the society. As for taking the vaccines, as mentioned by Dr. Ahmed Al-Mandhari, is one of the great steps to combat the diseases, and we call upon everyone, as we have the seasonal flu, those who have chronic diseases, who are less than 5 years old, the elderly, the pregnant women, to take the seasonal flu vaccines in order to decrease the spread of the virus and to avoid the consequences of those, if they don't have any signs. Well, and every country has their own diseases. So we have to take the medical consultation before traveling to ensure taking the necessary vaccines in order to have the system, the immunity system developed, like whether like if you have typhoid or pneumonia or any other diseases. And there are some guidelines in terms of drinking water, the behaviors. So it is always important for travelers to look at them and take the necessary vaccines. And they are available at the health essential services which are distributed around the kingdom. Thank you very much for the question. I'm not an expert in the infectious diseases, so I will give you an answer based on my limited experience. But doctor, as she is the expert, I might leave the floor for her. As I understood, are the seasonal flu vaccines will be sufficient or enhance the immunity? Well, as from my limited experience, they might benefit in enhancing the immunity system, but they are not an alternative for COVID-19 vaccines. You are the expert, Your Excellency, so what do you think? Thank you very much. Well, they are different viruses, but both of them might affect the infectious and the breathing system. So not to mention like a person might have both viruses at the same time. We don't have detailed studies on the consequences, but based on the recommendation of the WHO to take the seasonal flu vaccine at the same time of COVID-19 vaccine, or with a period of time difference based on the health conditions in order to avoid any complications. So we confirm taking both vaccines, especially for those mostly exposed to the diseases, especially to those with pneumonia. So we confirm to take those vaccines. Well, to conclude, we thank the excellencies and the ladies and gentlemen and reporters and for being here. Thank you very much.